This is Dr. Jeffrey Appelboom. I'm a neurosurgeon and spine specialist at Neurosurgeon of New Jersey. So you asked me if a disc replacement is a successful surgery. So I believe that both ACDFs, anterior cervical discectomy and fusion, and disc replacement can be very effective surgeries for the right patient. In order to know if you're the right patient, we need to look at your MRI. We need sometimes to look at a flexion extension x-ray of your neck to really see how much motion you have, to look at the bone above and below the disc, and to assess how much pressure you have on your disc, on your spinal cord, and on your joints in the back of your neck. But if you're a good candidate, I think it's a great surgery, and I've had a lot of successes with this surgery.